Hello, my name is Rebecca Bishop. In this video, my colleagues at the University of Illinois and I will demonstrate how to perform a transtracheal aspirate or wash in horses. This procedure is minimally invasive and simple to perform with a little bit of practice, and it is useful to collect samples for cytology and bacteriologic culture to guide treatment of horses with suspected pneumonia or other lower respiratory tract disease. We have no conflicts of interest to declare. First, I'll briefly review the basics of the procedure as I find this visual helpful to keep in mind during the procedure. We will access the trachea percutaneously in the middle third of the neck and advance the TTA catheter to the point where the trachea flattens out just beyond the thoracic inlet. Sterile saline is instilled through the catheter and then aspirated as the catheter is withdrawn slowly to fall into the tracheal puddle. Materials needed for sample collection include clippers, exam gloves, scrub and alcohol, sedation, lidocaine, sterile gloves, a number 15 blade, 30 or 60 ml syringes, a 3-way stopcock, needle, saline, materials for a neck wrap, blood tubes for sample collection, and the transtracheal aspiration catheter itself. We use the tracheal aspiration catheter kit sold by Myla International, which includes a 10-gauge introducer and a 12-gauge 28-inch sampling catheter. The catheter has a thin metal stylet and short protective sleeve that secures to the introducer. This size can be used for any size of horse, although a full tracheal aspiration kit is also available with a 14-gauge introducer and a 16-gauge 28-inch catheter. For demonstration purposes, our horse is restrained in the stocks, but we typically perform this procedure in the stall or an open treatment area. For thin-coated horses, clipping may not be necessary, although it is helpful for aseptic preparation and identification of anatomy. You want to prepare a wide enough area to allow palpation and manipulation of the trachea in the middle third of the neck and extending to the jugular groove on either side. The site is aseptically prepared, and the horse is sedated with either ditomidine or xylazine and butorphanol to facilitate restraint and minimize coughing. Tracheal puncture will be performed immediately proximal to the bifurcation of the sternocephalicus muscles, which are readily palpable with the horse's head extended. Here I am palpating to identify the bifurcation, and the site is anesthetized with a bleb of lidocaine subcutaneously. While assistant does a second aseptic prep, I will set up my sterile gloves and syringes. While typically 30 ml of saline is sufficient to recover a sample, I like to have a few syringes prepared. I've also opened my blade and stopcock on the glove paper. As when preparing for joint injections, I put on a single sterile glove to draw up the saline aseptically before donning the second glove. Off screen, I have also opened the aspiration catheter kit. Using one hand to identify my local block and then stabilize the skin, I make a stab incision with the 15 blade through the skin and subcutaneous tissues. I rotate the blade 180 degrees before removing it to enlarge the incision slightly. Next, using my non-dominant hand to stabilize the trachea, I insert the introducer through the stab incision, gently palpating with the introducer tip to identify the tracheal rings before advancing it through the tracheal ligament with a short, firm thrust. Once the introducer is within the tracheal lumen, I angle the tip slightly ventrad and fully seat the introducer before removing the stylet. You should be able to feel air flow through the stylet, or you can check with an empty syringe to confirm that the introducer is placed within the tracheal lumen. There should be freely flowing air and no negative pressure. I prepare the aspiration catheter by removing the outer plastic sleeve, and we prefer to also remove the stylet and attach the 3-way stopcock at this point. The 3-way stopcock allows you to easily expel air from the syringe during aspiration without losing sample, and to instill a second syringe of saline if needed. Although we are using slip-tip syringes in this video, Luer lock syringes make this process easier. Before inserting the catheter, we want to get an idea of how far the catheter should be advanced to reach the tracheal puddle. To do this, I measure it against the horse and visualize how much catheter should be remaining when inserted to the appropriate depth. I then remove the stiff plastic sheath and coil the catheter in my dominant hand to protect it from contamination during insertion. I feed the aspiration catheter through the trocar seating and securing the protective sleeve to the introducer. I then attach my syringe and ensure the stopcock is set to inject through the catheter. 30 mL of saline is quickly infused and then aspirated back. The appearance of foam and particulate in the effluent indicates an adequate sample has been collected. If fluid is not immediately retrieved, the catheter is withdrawn or inserted slowly until it falls into the puddle. The catheter is withdrawn, followed by the protective sleeve and the trocar. We like to apply an antimicrobial dressing such as SSD over the puncture site, and further covering the site with a light bandage of gauze and elasticon or shear light is based on clinician preference. If you choose to bandage, take care the adhesive elastic bandage is applied without excessive tension. The bandage is then removed in 12 to 24 hours. The samples collected from this healthy horse have minimal particulate matter or mucus, which is expected. Samples are then placed into an EDTA purple top blood tube for cytology and a plain or red top blood tube for culture. Here are samples from clinical cases showing variations in the appearance of abnormal tracheal aspirate fluid. From left to right, there are samples from 2 horses with aspiration pneumonia, a case of rhodococcus equine pneumonia, and a horse with acute respiratory distress syndrome, which had negative bacteriologic culture. Thank you for watching this video. With some time and practice, we hope you will be able to apply the transtracheal aspirate technique to aid in evaluation of horses with respiratory disease.